Hi, Dr. Drake here. One thing we talk about all the time in our office is that symptoms are usually not the whole story. We always want to listen to what the body is saying, but symptoms are often a signal that something deeper is going on underneath the surface. And for many families, that something deeper is the nervous system stress. So let's talk about what that actually means. Your nervous system is the master communication system of the body. It helps coordinate movement, digestion, sleep, immune responses, stress adaptation, and many more things. In other words, it is not just responsible for how your body feels. It plays a huge role in how your body functions. That is why two people can come in with very different struggles, but the underlying conversation may still be about the same thing: how well their nervous system is regulating and adapting. For one person, nervous system stress may show up as headaches, neck tension, back pain, or just low energy and fatigue. For a child, it may show up as poor sleep, big emotions, sensory overwhelm, digestive struggles, or difficulty transitioning from one thing to the next. For an expecting mom, it may show up as tension, discomfort, poor sleep, or feeling like her body is just having a hard time settling. And this is where a lot of people get really frustrated, because they may be told, well, that's normal, or they'll grow out of it, or just wait and see, or everything looks fine. But as a parent, or even as an adult living in your own body, you know when something feels off. You know when your child is struggling more than they should. You know when your body is having a harder time keeping up. You know when the same pattern keeps showing up over and over again. And that is why we believe it is so important to look deeper. We do not want to simply chase symptoms. We want to understand why the body is having a hard time adapting in the first place. That is where Innate scans come in. Innate scans help us measure patterns of stress and dysfunction within the nervous system. They give us an objective information about how the body is functioning, how well it is adapting, and where stress patterns may be building up. Now, these scans are not about labeling someone. They're not about diagnosing a condition. They're not about putting a person into the same category. They are about helping us understand your body better, because your story matters. Your health history matters. Your stress load matters. Your goals matter. Your daily struggles matter. And the way your nervous system is functioning matters. When we combine your story with the information from the scans, we can create a care plan that is personalized to you. That's a big deal, because care should not be cookie cutter. A child struggling with sensory overload may not need the same plan as a child struggling with low muscle tone. A mom in pregnancy may not need the same plan as a dad dealing with chronic low back pain. And someone who's been stuck in stress mode for years and years may need a different approach than someone who is coming in for wellness and prevention. The goal is always to meet your nervous system where it is. When we find areas of tension, stress, and subluxation, we use gentle, specific chiropractic adjustments to help improve brain-body communication. The goal is to reduce interference, support regulation, and help the body shift out of constant stress mode and into better state adaptability. When the nervous system starts adapting better, many families begin noticing changes in everyday life. Maybe sleep starts improving and transitions become smoother. Maybe posture starts changing, or recovery improves. Maybe the body just seems calmer, steadier, and more resilient. And those are the changes we care so much about, because this is not about helping someone feel better for a moment. It's about helping the body function better over time. That's why Innate scans are such a powerful part of a personalized care plan. They help us see what we cannot see from the outside alone. They help us track progress over time. They help us know when the nervous system is shifting, adapting, and becoming more resilient. If you've been wondering why your child seems stuck in stress mode, why your body keeps repeating the same patterns, or why symptoms keep showing up even when you have tried to manage them, it may be time to look at the nervous system, because your body is always communicating. The question is whether we are listening closely enough. At Innate Family Chiropractic, we use your story, your goals, and your insight scan results to create a care plan that is specific to you and your family. So if this sounds familiar, we would love to help you take the next step. Give us a call at 918-272-0303 or head to the blog to learn more about how insight scans can help the foundation of personalized care.